just breathe. I don't know if anybody's ever said that to you when you were really irritated or upset or just freaking out about something. Sometimes it can be like, calm down. But the truth is, if you can just breathe, you will change your physiology of the moment, because your breathing will control your heart rate. It will change your vagal stimulation so that it will stop all of that high anxiety activity that's going on. Just breathe. What we'll talk about here is we're going to do diaphragmatic breathing. If you happen to be a singer, you know what this is, because you have to breathe into your belly in order to make the sound big and be able to sing. I don't sing, so I don't know about that. Then there are a couple different types of diaphragmatic breathing that we'll talk about. There are several more that I'm sure you could go online and look up. And then this heart-centered breathing that comes from HeartMath is a miraculous technique that can change your mood and attitude almost instantly. Breathing. Well, as the name suggests, it's about the diaphragm. The diaphragm is the muscle that separates the lungs from the rest of the organs. It's large, it's dome-shaped, and it is the most efficient muscle to use for breathing. I don't know about you, but I've had anxiety issues, and when I notice that, I'm always breathing way up in my chest, very shallow breathing, and usually through my mouth. That's the worst thing you can do for anxiety because it makes it worse. What we want to do is not breathe just using the ribs and expanding the upper chest, but through the abdominal muscles and stretch the diaphragm. So I think everybody, well, I don't know, maybe you don't. Of course, we want to use the nose to breathe. And then some of these will require breathing out through the nose and some through the mouth, but breathe in through the nose. If you're terribly clogged, you need to find out how to get unclogged, because you really need nasal breathing if you want to control your anxiety. What is it? It's consciously using the diaphragm to breathe fully. We very often are breathing way up here in the chest, and we never exhale fully. And because of those two things, our physiology, our metabolism, our everything in the body is not functioning optimally. So we want to have a regular practice of diaphragmatic breathing. If you do this as a regular practice, it will change an awful lot of things. It strengthens your diaphragm. It decreases the amount of work you have to do to breathe all the time. It increases your oxygen availability, which actually could improve your brain power and your energy level, everything, because if you don't have oxygen, nothing's going to happen. And you just use less energy and effort to breathe. All right. It helps in effective relaxation because it stimulates the vagal nerve, which controls your autonomic nervous system. You don't have to know all that, but what it does is it takes you out of fight or flight and into rest and relaxation. It improves all your muscle function during exercise, preventing strains. But part of the improvement is because you have an increase in blood oxygen saturation. You want lots and lots of oxygen in your blood if you're at any time, but especially if you're exercising. And your lungs eliminate a lot of waste. So if you don't exhale fully, you've got this stagnant, awful mess sitting in your lungs. But if you breathe and exhale fully, you're helping your lungs be another way of eliminating waste from your body. It reduces your blood pressure, reduces your heart rate. And I've had it reported that I've read that I actually experienced this. If you do diaphragmatic breathing 10 minutes every day for 11 days, you'll notice that you don't need to sleep as long. And the reason for that is that you will sleep deeper and you will get improved sleep and you'll wake naturally earlier than you normally would. I found that pretty amazing. Just from doing 10 minutes a day for 11 days, it changed. So diaphragmatic breathing is you breathe deep in the belly. If you've ever watched an infant breathe, they aren't moving their ribs. Their little tummies go up and down because they're breathing properly. They haven't been taught to suck in their stomach and tuck their hips and do all these things that we do to armor ourselves. Singers have to do this or they just don't have the capacity for their voice. So the diaphragm moves up and down properly. It massages the organs below and the lungs above, and it helps all the organs perform their functions better. So here's the way we're going to do it. I did this reclining because I'm not quite limber enough to sit in a lotus position for a long time without having a lot of pain. So it's easiest if you lie down on a flat surface. You put your knees up with your feet flat on the surface, and you put one hand on your chest and one hand just above your belly button, just below your ribs. And what we want to do is when we start with an exhale, when you exhale, squeeze your abdominal muscles so that the bottom hand goes in. And then when you're ready to inhale, inhale so that the bottom hand goes out. So the top hand is going to stay still while the other hand is moving. Exhale, you squeeze out. Inhale, your belly expands and your hand moves up. When you exhale, your belly goes down. When you inhale, the belly expands. And you'll notice a certain amount of rocking in the hips, potentially. You can help exaggerate that if it helps you. You can arch your lower back a little bit when you breathe in to expand, to elongate your abdomen, and then flatten your lower back against the surface to squeeze the muscles to exhale. There are a number of ways to do this. There are some videos on YouTube. If you'd like to go look them up, you can. But what we want to do is we want to do this for about 10 minutes a day. It'll become easier. And then this is the basis of almost all the breathing techniques that we're going to teach you to manage your anxiety. Anything else? Did I miss anything?
No, what I find interesting is that the diaphragm is a muscle and its only purpose is to breathe, to pull the lungs down so you get more oxygen and push the lungs up to get rid of, the old stale air. And I used to tell my kids, when they were freaking out that, because blood picks up the oxygen and takes it where it needs. And when you are freaking out, you're breathing so shallowly, you can't get blood to your brain to be able to think rationally because you're just in fight, flight, or freeze. But I found that interesting that the diaphragm's only purpose is to breathe. And what happens when you don't use a muscle?
Yeah, it atrophies.
Yeah. And it is hard. I remember when I first started doing diaphragmatic breathing, it was uncomfortable. I felt
it's a
like
practice.
Yeah.
It's a practice. You don't know how to do it immediately unless you've been doing it since you were a baby.
Yeah.
Or you're a singer, and singers practice this a lot. It's something that you have to practice, but it has enormous benefit if you do.
Yep.
Now you can do the same thing while you're seated. You sit comfortably, you can sit in a chair, you can sit on the floor, but you want your head, neck, and shoulders relaxed and straight. And you, again, place one hand on your chest, one hand below your rib cage, above your belly button, and you breathe in. You can start with an exhale or an inhalation. You breathe in slowly through your nose, and your abdomen, the lower hand, goes up. And then you breathe out, and your lower hand goes down because your abdomen squeezes. So in, it's as if you're breathing all the way down into your pelvic floor. And then you squeeze and push all the air back out. And then you relax and pull the air in and squeeze and push all the air out. So you can do this. You can do this also walking. After a while, you'll realize that you can do diaphragmatic breathing all the time. Ideally, that's what we would do. We would breathe diaphragmatically all the time. This one is more powerful for anxiety, even more powerful. But the purpose of it is to exhale all that old air that we normally don't ever get rid of, all that part of the lower lung that's stagnant. It eliminates the waste from the lungs, it calms the nervous system, and it helps prepare for meditation. So you do breathing, diaphragmatic breathing, the way we talked about before. But when you start out doing diaphragmatic breathing, you're going to breathe equally in and out. For 2 to 1, whatever count I use to breathe in, a lot of people find 3 to 4 a good place to start. So if I breathe in 3, I breathe out 6. And I squeeze and squeeze and squeeze. And some of you will cough. And you'll cough because you're opening up parts of your lungs that you haven't used in a long time. And then you breathe in again. And then again, you breathe out and you go twice as long. You really squeeze all that air out. And again, it may cause coughing in the beginning, but that's good. You're opening up parts of your lungs that have been shut down. It's like they've been out of order for a while, and now you're going to open them back up. Do this practice for as long as it's comfortable, beginning with 2 to 5 minutes a day, perhaps. Part of your diaphragmatic breathing time could be in this, or you could add this as a separate practice. Do be aware, though, that if you do this, you may cough, but you also may be dizzy. So be careful getting up right after you do this, certainly until you get used to it. And you've cleared out your lungs and you've started using more of your lung capacity, and your brain doesn't go crazy because it's got oxygen all of a sudden. All right, explosive exhale. This is really pretty similar to the one we did before, except that it doesn't have a specific amount of time. You're just going to blow the air out as hard as you can quickly. So it's really explosive, fast blowout. So you breathe in and then you breathe out hard. And it accomplishes the same sort of thing as the 2 to 1. I find 2 to 1 is probably the one I use more often. This one might be quicker. Either one, whichever one feels best to you. But you breathe in and then you explode the air out and you squeeze really hard to get it out so that it actually is very noisy. So you might not want to do this one in church or somewhere where it's supposed to be quiet.
I know they do this in yoga with kids, and they call it lion's breath, where you breathe in and then you just like you're fogging a mirror a bit. So I have fun with that.
That's cute. I like it. All right. So now this is one of my very favorites. Like I said, it comes from HeartMath, and HeartMath has a lot of new things now, that recordings and things to teach you how to do some of these things, and some devices to teach you how to reach a state they call coherence. But I'm not here to advertise them today. With heart-centered breathing, what you do is you close your eyes if that's comfortable, and then you just begin a slow, easy breathing, not deliberately doing anything to your breath, just breathing. And imagine that you're breathing into your heart or your heart center. And just breathe gently into your heart center, until you begin to feel your body relaxing. The first thing I notice is my hands and feet will start to feel a little bit prickly, maybe. Not an unpleasant situation, it's just they're relaxing. And then I start to feel that relaxation spreading on my arms and legs. Your first indicators may be quite different than mine, but just breathe until you notice that you're starting to relax. You're starting to calm down. And once you've reached that spot where you feel like you're calm, your body's at rest, imagine something, anything, an image, a person, a place, a thing, that just makes you smile. Something that makes you feel happy, positive. It can be anything at all. When you have that image in your mind, you may find you are smiling, because it's hard not to if you found a really good one. But once you feel that smile, continue breathing with that smile. Breathe that smile into your heart center. Just breathe it into your heart center and allow the heart to send it throughout the body. The heart sends messages about our status constantly every time it beats. So just have that happy smile beating throughout your body. Now, open your eyes and notice how you feel. Do you feel better? Do you feel different? Do you feel happy? Do you feel like smiling where you didn't before? You can use this for a variety of different mood shifts. You can use this to become more focused. If you can think of a time when you were really focused, whatever you can imagine, whatever you can visualize, and it doesn't have to be a vision. It can be something that you just know. Some of us are not very visual. Some of us are auditory. Some of us are kinesthetic learners, but just something that creates that mood for you. And then you breathe it throughout your body. You will change the way you feel. And it's incredibly quick. See, we did that for probably a minute. And there you go, you're changed. How did it work for you?
I feel a lot more relaxed.
Mm-hmm.
I thought I was relaxed, but like you said, when the hands, I could feel it, like my hands just sort of spreading out and just, and that was what, less than a minute, you said?
Very short.
Wow.
Very, very short. Yeah, it doesn't take long at all. Now, it does take some practice to learn to use it so that you can use it effectively in any circumstance. Putting Elizabeth to sleep, I think.
I am so relaxed. It's like,
yeah.
Wow. Yeah.
It means it works, right?
Yeah. It's very nice.
Then we have a relaxation technique that is a visualization.
Can I stop you for a quick? Because I appreciate you saying that just a minute ago, that some of us are not good at visualization, because I'm one of them. It's like they'll say, clear your mind. Now, what do you see? And it's like, I just see black.
Yeah.
It's frustrating. Is it just, what is that, bad or good, or?
It's not any of those. We call it visualization, but it isn't necessarily with the eyes. It is an experience where you allow yourself to be somewhere else, or you allow yourself to do something in your imagination, whether you see it as a picture or it's just a felt sense of knowing. It's just doing something in your imagination.
Cool. I can't wait to hear this.
Well, it's the process of using your imagination to focus to create a scene or situation so realistic that you feel as if you're really in it. And by doing this, I generally use some scene like a garden, because there's so much sensory input to imagine. And what we're trying to do is experience the sensory input. I don't visualize a smell. So no, I'm just doing something in my imagination as opposed to in the real world. So the better I get at being able to imagine things, the better I get at using this for whatever goal the visualization has. We have found that using this technique can be as effective as actual practice for sports. Can you imagine? This is my kind of practice. Okay, I'm going to imagine shooting a basketball. The reason I think that this works so well is that when you do actual practice, you make mistakes. And so you're practicing mistakes. Whereas when you do visualization practice, it's perfect. And the visualization practice actually preps your muscles and all the pathways that need to be prepped to do the sport well without the mistakes. I find that just fascinating. You can use this for preparing for a test. You can use it for a presentation. You can use it, if you're using it for tests or anxiety, you just visualize going through the test and being calm and using what your test taking techniques, or if you visualize giving the presentation, or go through the presentation and visualize it going very, very well. Even when you do rehearsal, that's a sort of visualization. You're visualizing the people responding to your rehearsal. You can rehearse in your imagination where you don't make any mistakes. I find that really interesting. And some people use visualization to stay focused on their long-term goals and to enhance success. You hear about vision boards. Well, all of those vision boards are just to give you little bits of cues to remind you where you want or what you want in your life, and to keep you on task or focused.
There is a lot of research on this visualization. It's just, how it's even more effective than actually doing it.
Mm-hmm.
Football players, soccer players, I like that idea of going out there and shooting perfect baskets. It's
right. Or golfing.
Great.
I'm not a golfer. I don't want to be a golfer, but golfing would be a good one.
Yes.
I can't imagine who first dreamed up getting a stick and hitting a rock 3 miles down the road into a tiny little gopher hole. But I guess that was brilliant. Not for me, but okay. So you can use this visualization. The word is misleading, and I'm glad you brought that up, because it's just doing something in your imagination. However you do things in your imagination, it doesn't have to be sight at all. It doesn't have to be a picture. Mine are not pictures. I don't visualize with pictures. I visualize with a felt sense of what's happening. Sometimes I have an idea that I can translate into a picture, but it doesn't come as a picture first. So it doesn't hurt anything at all if it's not a picture. We can do a visualization exercise that I think will put a link here for you to go to the visualization exercise separately. But what I'll do is it'll be concentrated focus on a specific place. You can remember or imagine a calm, serene, and tranquil place where you feel or have felt at peace. It can be any scene, a garden, a meadow, a mountain, a beach, or with a certain person. Any peaceful, pleasant scene can work. You gradually build up the sensory detail to greater and greater definition so that you feel as if you could step into the place. Notice what you see, hear, smell, taste, feel on your skin. Look closer. Notice more detail. This takes up so much bandwidth that if you're a person who has trouble falling asleep at night, this will just take up so much space that all those other thoughts don't have anywhere to go. They just disappear. And so the next thing you know is the alarm goes off because you were just in this wonderful place and none of those thoughts had any room. It can be self-guided or it can be directed by a voice. It's very useful to go to sleep. It can be very useful to take a break and get refreshed, reset, recharge during prolonged effort. You know, like if you know that you have to do some great big project and you know it's pretty exhausting, then you can take a break and use visualization. And oftentimes, depending on how the visualization is set up, your break can seem like you've had a whole night's sleep. It's amazing how much you can do, how much you can do with your imagination. It's basically using your consciousness to create results in your body. It works great. You can use it for healing as well. And here's the link.